Hello guys, this is Farshid. Hello to all the acupuncture graduate who wants to, as a provincial requirement, needs to pass modality. I'm going to help you to pass your modality. In the video part 1, which is this one, I will give you tips and all the information you need for exam. And the video part 2, I will do it practically, and you need to memorize whatever I'm doing and copy me so that you will pass the exam, definitely 100%. So in the exam room it is stressful. When you enter the room, this is a small room and 2-person 3-person already there, and one person comes to your face and say, okay, I want to take a picture of your number, and then your mind went blind, and so your brain doesn't work there, so you need to do by your heart. So by this way you need to practice already. In my opinion, at least you need to practice 50 times in your mind. Well, when you're driving, just in mind repeat whatever you know, and at least 20 times practically do it on the table, and just do it and video yourself and see what mistakes you have. So definitely you'll pass. So video part 2, you need to just copy me exactly. So let's get started by telling the all you need information. So first of all, buy a small one as much as possible, not very small but not very big, because when you enter the room you need to put it on the table, don't put it on the ground. So, and when you enter the room, just after greeting, open your sheet and wait for the prompt. The prompt will right away set up your sharps. So when you want to take out your sharps, at the same time take out your waste container as well, and this is set up your. Open this lid and put it as far as possible to the your clean field and the patient is in your bag, because there is sink and you are putting set up here, patient here, so this much should be away from the clean field. To my opinion, put it just behind your kit, or maybe if I keep it here, so that place is very good because you just go and discard. Then they ask you set up your waste container. So waste container, here I use Ziploc. I use a Ziploc, and just reverse it, and you can use it as a waste. But when I put it here, I already just make it ready. So just I need to make it wide and say I put my waste container in the safe distance from my clean field. So there was a bag, it's a biohazard bag inside it. In case I not forget, they will not prompt you to or say about something, but you say, oh, I have, and also I have a biohazard bag in case of a blood-soaked cotton balls or gloves. I'll use this and put it here. Okay, so you're good. And after that, they ask you that set up your clean field. Just this one. So for that, you say, okay, I wash my hand, wear utility gloves, wash and sanitize with low-level disinfectant the surface area, dry it, and put the gloves in the waste. And for those people who has a lesion on their hand, at this point, it better to say, as I have a lesion on my hand, I will use gloves for all these 3 procedures. And my suggestion to you guys is that it is better if you don't have any lesions for practice, and when you're practicing with this imagination that you have a lesion, so that if just the day after, it happened to one of my friends, just the day when she wake up, go to the exam, there was a scratch from her cat So just she missed the exam because she was shocked. She was not prepared. Prepare yourself. Imagine you have a lesion. So in case, okay. So at this time, I say, as I have a lesion in my hands, I will use gloves for all these three procedures. So I wash my hands, wear gloves, and I'm ready for that. So this is my sterile clean field. I'm explaining to you guys. I hold it in a way that when I remove it, I can remove it very easily because I can just touch one side and it will open. So when I'm explaining to them, I say, okay, I wash my hand, wear gloves. My clean field is sterile, and I'm going to touch only the sides of it so that the central area remains intact. And I put it on the designated area that I cleaned it. So one tip about this, when you go exam rooms, each exam room is different from other exams. My exam room, I had plenty of room. My friend's exam room, she had little place. So even she had to put the kid on the ground, which is not supposed to do that. So prepare yourself for a very small place. So your kid should be average size or small, and also your clean field. If you look at here, I cut it here. It was maybe 10 more centimeter, but I cut it. I didn't need that. When you put your stuff here, you can use, what kind of space you need. So just adjust it for yourself. So, okay, you did. At this point, they'll ask you to point at least one needle for each step. Just consult your sheet. They have your sheet, and I forgot to say that when you enter, they say, okay, this is your sheet, and you have to just read your sheets. Okay, if I have it in here, yeah, and on the sheet there's 3 points, and so you have to write, okay, which kind of needle you need, 1.2 needle, 1.5 needle, and so on. So they ask you consult your sheet and then open at least one needle. So there is one tip here. For example, here is 1.5 needle. So if you put just one needle, it will fall down. It takes your time. Just these 5, make it 5, because they ask for at least one, so more than one. So just open it, and right now this is the second one didn't open. Supposedly it is open. So, and just make it fold and put it here. When you come to the clean field, you shouldn't compromise. Your hand goes over it. You have to be around. Just take it from around. So here is okay. With one hand I can open it, or even with 2 hands, I'm not compromising. It's good. So this is 1.5 needle that I want, and this is 1 needle. Again, and put it a little further from here. Your hand can go here. Then I ask you to put at least 3 alcohol swab. So for alcohol swab, so it's better you just cut 3 edges of it. So if you cut from 3 edges, when you want to remove it, or even for placing on the ground, it is easier for you guys to do it. Okay, so, and you just mentioned, I'm going to ensure not touching the alcohol swab, just the cover, and watch here, and okay, and you put it here, and easy. When you want to remove it, it is easy. So you have to do 3 of them. And when you're putting ask you to put some cotton ball. So you mentioned that the cotton ball are sterile. drill, and I'm going to ensure that they touch only the central area, and I'm ensuring not compromising the clean field. So they ask you just proceed with the first step. First step, you need to consult your shield. I think my sheet is here. Okay, so for example, here is GB20 and tonifying method. Ask you tonifying method. Okay, so at this point you need to go to the patients, which is on the back. Just turn around back. I don't have another table, I use here, this place. So come to the patient and say, you have to just inform consent. I let my patient know the risk associated with these all three procedures, and I obtain a signed informed consent. My patient is ready for treatment. I wash my hand, wear gloves. I inspect the skin for any lesions or contraindication, palpate the skin to identify the points, wash my hand, wear gloves, and then I'm ensuring just touch inside the cover, and okay, you sanitize the area and discard. So the point is GB20. So any point you're going to have to explain. For example, I use one hand, and remove this, and say, according to Deadman, this point is, I shouldn't touch my glasses. If I glass, I have to discard this, wash my hands, and again the process, sanitize. So make sure, if you after washing your hand touch anything, just discard everything, again start from the scratch. So suppose I'm not touching, so we say according to Deadman, this point is perpendicular, slightly inferior or toward the nose, up to 1 chin, no deep needling at this point, avoid medulla or spinal cord. This is very critical. This is, if you don't say avoid spinal cord at this point, it will consider as critical error and your failure. So for the near the CNS chest, it is very important to just mention, otherwise you will fail. These are critical, or near the large vessels. So I sanitize and say, okay, head is here, perpendicular, slightly inferior. And for tonification method, I will use breathing. Ask patient to breathe out, and also I will turn clockwise as a second method of tonification. Always for tonification you use 2 or 3 methods, because in case if you go in the exam and forget one of them, don't panic. You use the second and third, and even in the exam do it 2 or 3, doesn't matter, because you at least one. So they prompt you to remove it. For remove, I wash my hand, wear gloves, and say, I close the pore right away as a third method of tonification. Keep it at least for 30 seconds. Wash the side for any bleeding or hematoma. It is good. I discard. So right now your first step is done. They said consult your heat shield and proceed with the second step. So the second step is moxa and the needle and UV24. So in this step, so whatever you have bags here, put it up, because you don't need the up part. So for moxa, all the stuff you need, put it in one bag. Here, I put it in this way, you will not forget what. So I bring them. And another thing, even for I showed you that the waste container was open. So even for this one, I didn't lock it. It's probably open. It saves your time. Take it out and put the extra up. So, and even you can just go needling and then bring them up. Okay. Suppose I didn't bring them out. So this is it. Go with the second step. So this is Moxa on UB24. Okay. I wash my hand and wear gloves. I already have informed consent and patient is ready for treatment. I inspect the skin for any lesions or contraindication, palpate the skin to identify the point, wash my hand, wear gloves, and I take one alcohol swab, sanitize it, and the point is UB24, and I will use 1.5 needle. And when taking this, say I'm ensuring touching inside the cover, and I'm not compromising the clean field. Just mention them. And so every point you have to use, you have to explain according to Delman what is going on. So this is UB24. According to Delman, it is perpendicular up to 1.5 tune, and there is no specific contraindication at this point. So I go about 1 tune, get dirty. Okay. Now I go and grab my stuff, bring out. So, and the first thing you have to do is put the heat shield. So here, just verbalize what touching, say, the heat shield is sanitized. However, I'm going to ensure that it doesn't touch the shaft of needle, and you have to be careful. But you know, in the exam room, because you are stressful and you are shaking, most likely you'll touch it. Don't panic. If you touch it, it is one non-critical error. Still you have 2-3 more, but it is not critical. But if you practice more and be aware of the stressful environment, maybe you can just manage it. Don't touch it. Okay, now put the moxa. I prepared several moxa in case, and you know, I put one incense inside this bag because in case if I forgot, it showed me, oh, you have to use incense. So this is my trick, so you can use your trick. When putting the moxa, just use one hand, don't go like this. Take your hand out and say, okay, I'm going and verbalize. I'm going to ensure that I will not touch the shaft of needle. Say this now. Okay. Here you have to ignite it. Okay, this is my incense, and my lighter, and prepare your ashtray here too. Open the ashtray. Okay. Say I ignite. Just you have to show, not practically do it. I ignite the incense. Sniff it. Take your ashtray with yourself. I ignite the moxa, put it in the ashtray, and I extinguish it away from the patient and put it away from your clean field and patient. So you are done here. In the exam room, they just right away they ask, okay, remove them like that. But it is possible that some examiner they are not in rush and they let you some time. If they give you time, just start saying, okay, when you finish this one, say, I stay beside the patient or beside my client and making sure the cone bears 3/4 of the way down or patient feels hot, then I remove the moxa consciously. When you're talking this, at the same time trying to just save time and put your moxa remover in the ashtray, hold it in your hand. And they prompt, okay, remove it. When they prompt you, go and say verbalize that. I'm going to ensure that it doesn't touch the shaft of needle. Okay, put it here and put it away from patient. And remove, and again say verbalize. I'm going to ensure not touching the shaft of needle and put them away. Suppose this is, if it's real and moxa on that, this is hot, you can remove it. And just verbalize. The needle is hot and I'm going to use forceps for that. All I need is just bring one bag, so I have all in here. So, you know, all the bags has to be labeled, and all of them needs to be sanitized. Ashtray sanitized, moxa remover or force. But for the forceps, it is to be sterile. Sterile forceps. Okay. I open it. Some people put it because it is sterile going on the clean field. It is possible to do it, but it is, to me, is doesn't. You don't need to do that. You know, just open the plate and take it a little bit up, a little, and put it here, and say, I wash my hand, wear gloves, take cotton ball, and take it out. So remove it and say, okay, I'm looking the side for any bleeding or hematoma. It is good. I can discard them, and I discard them properly. Put them back. The second step is done, and the third one is cupping. So for the cupping, I put this stuff off when I don't need them. So consult your sheet and then do this. The third one. The third one is fire cupping on UV 25th. UV 25th. So I say I wash my hands. My patient, I already have informed consent. My patient is ready for treatment. I inspect the skin for any lesions or contraindication. Palpate the skin to identify the point. Wash my hand. Wear gloves. So the point was UV 25. Okay. I again take one alcohol swab, ensuring it's touching inside. Sanitize the bag. The point UV 25. I use 1.5 to needle. So according to Deadman, I have to say, oh, this is perpendicular up to 1.5 tune, and there is no specific contraindication at this point, or caution at this point. So I go about 1 tune and get dirty. Then you need to put cup. So you say, okay, this is my 99% alcohol swab, pre-soaked cotton ball. So for the cup, you have to mention this cup is dry, and I'm checking the rim for any cracks or defect. It is intact. And when you put it on the clean field, you have to be upwards. So I just rearrange it, open it, this one, and when you open it, take it from the bottom. This rims here is good place to take it hard. Okay, you open it already, and you can just, as far as we can, you just note it, okay? And you just turn around and say, okay, and I'm not trying to not compromise the clean fold. And you can mention the second cup also is sterile, and I'm checking the rim for any cracks or defect. It is intact. So okay, open this one again, grab it from the bottom completely. You can just turn around or anyway, because this area I put for supposed patient, but patient is back. So from here, whatever is not compromising here. You shouldn't go over it. Okay. Now I'm sitting and making sure it doesn't touch the clean field. Be careful. So, and we can start. Squeeze for extra alcohol and take it in. Oh, sorry, I'm looking for him. It doesn't drip. Okay, it's ready for treatment. And then ignite it and put it inside. Okay, and check it. Okay. The pressure is good. The suction is good. Okay, and then discard them. It's better to not put it to waste. Put it just inside the ashtray, and they prompt right away to remove it, but in case you have time, say, if they give you time, say, I stay beside patient feels comfortable. If patient feels uncomfortable, I remove the cup or adjust it, and say they remove it. And say again, wash my hand, wear gloves, because you need to touch the skin of people. Okay, remove it. When you're a bit, say, I'm going to put the cup in a reprocessing bag to sanitize again. Put it again, and they say remove the needle. wash my hand, wear gloves, and you take one and okay, inspecting the side for any bleeding or hematoma. It is intact, so I can discard. So I think I give you step by step all information you need. So you need, as I told you, stuff you need for mock stuff, put in one bag. Don't lock the bag and put it inside it, everything inside and organized. But for needles, just needles don't need bag. Put it here, you can use this here. So I will see you on the part 2. Good luck.